When people drive 3 to 4 hours to see our office, I'm grateful, but I'm also curious, why didn't you go to somebody closer? And so when I ask a couple questions, I find out some answers. And one that I found out recently, I said, surely you must have seen other practitioners who do functional type of healthcare closer to you. And they said they have, but they didn't ever really come up with a good plan. They said that the doctor tested them, and then since the tests were pretty normal, they didn't have a good plan for them. And so here's the deal. We look at this differently. We don't test to develop a plan. We develop a plan based on a person's history and examination, and then use the test to, one, prove out the plan and give more information to the plan so that we have a more complete picture and that we have even more guidance. But we already have the plan in place from the person's history and from their exam. And so we're listening through key things, and then we're sorting out through our hidden model, through the HIDN hidden model, where the biggest factors are. So all the time when I'm listening to someone, I'm working this through in my head. Is this a hormonal system problem primarily that's throwing the other things off? Or is this an immune problem that's throwing off the hormones and the nervous system? Or is this a neurological problem that's throwing off the hormones and the immune system? So I'm always thinking through that hidden, and that's what we have a trademark on. Hormonal balance, immune strength, detoxification, efficiency, and neurological connection. So I'm always in that thought pattern. And I'm going to listen, where is the key and what's the head pin? Just like bowling, you got to hit the head pin. So I'm listening, what is the head pin? How are these all related to each other? For example, with this person recently, they said, one of the things they said was that after they eat, their ankles hurt. Well, how could the ankles hurt that quickly after someone eats? Well, that can only happen if they have a leaky gut and they eat and the things get into the immune system has to react to things too soon because the barriers in the gut are broken down. So then our plan becomes fix their gut. And then one of the ways to fix their gut is to get a good DNA-based stool test. So the stool test is actually to back up what my plan is, and the stool test is to find out more information in case there's other pieces to the picture that I couldn't see with my exam. That's what the test is for. The test is not to develop the plan. The plan is already in place from thinking through it with the history and the exam, and then the test is just used for more information and more focus and more clarity and more guidance, and to be able to see, black and white. There's something valuable about seeing things in black and white, as well as a doctor telling you something from an exam. So that's how we approach our testing, our functional testing. We use it to gain more information when we already have a plan. So I'm not wasting people's money with a bunch of tests that are just rote tests because Winners Wellness Center does XYZ, and we always do XYZ on everybody, and then we try to develop a plan. No, we don't do that. We listen and think through hidden, and then we develop our plan. Hormonal balance, immune strength, detoxification, efficiency, and neurological connection. Then we develop our plan, and then we pick a test that will help us with our plan. So that's how we deal with that, and I think it's a very important thing for people to know, and a very important thing for you as a patient to know how your doctor approaches this. And so you might see some doctors that do test everybody the same test, and then you might see how we do it, and you might choose which you like better. Personally, I think we get better results this way. Obviously, that's why we do it. And we've put a lot of years into this hidden model, which, by the way, I didn't have on here, but is trademarked. So if you're looking for someone that can really sort through things and help find the head pin to get you healthy, That's what we focus on. I'm Dr. Michael Winters, Winters Wellness Chiropractic Redefined. Watch many of our other videos on YouTube. Subscribe to us here. Like us on Facebook. We have several private groups on Facebook. You can see that off of our main page that relate to autoimmune conditions and brain health conditions and sick and tired of fit and fabulous, which is overall health, and especially now we're talking a lot about insulin resistance and diabetes and hypoglycemia. And then we'll be talking a lot soon about infertility in that group as well. So check us out, get more information, and then give us a call, 270-554-2141. I'm Dr. Michael Winters, Winters Wellness Chiropractic Redefined.